Hey guys, Curtis Alexander, I'm a pharmacist. In this video, I want to talk about using chromium to help control blood sugars. Does it work? Is it a good idea? If it is, how should you do it? Those sorts of things. So I want to hop right into it. So chromium is actually, it's an essential trace element. It is available in foods. We'll talk about that later. But it's referred to as glucose tolerance factor, which kind of pinpoints that it obviously plays a role in your glucose control. Now, the one thing, I'm going to go over some of the studies and what we've seen in folks who supplement with it. So decreased chromium levels have been associated with diabetes, they've been associated with cardiovascular disease, impaired glucose and insulin, and lipid metabolism. So it clearly does play a role. However, something to keep in mind, people will go, well, my chromium levels are good, this, that, and the other thing, but your chromium levels aren't in equilibrium with your body stores. So basically what that's saying is you can measure your chromium, but it's really not giving you the whole picture. So I wouldn't rely too much on, in this particular case, on your blood levels. Now, we do know that patients who were given total parenteral nutrition in the hospital, like if they have to get their food through a bag, basically that's a TPN. They've actually given folks TPNs without chromium in them, and they actually developed diabetes symptoms, and those symptoms were reversed when the TPNs had chromium in them. Another couple of studies, we've had studies that give people anywhere from 50 to 1,000 micrograms. By the way, I'd never go as high as 1,000, but they have in studies. They did that for 4 to 25 weeks. Again, we see fasting blood glucose improvements, insulin improvements, hemoglobin A1C improvements. Then we've had other studies that supplemented with it, and they either did not see improvement, or the improvement they saw was not clinically significant. So we do have some conflicting studies. What we do know about chromium, what it's doing in the body, it is a for glucose transporter, basically activator, so it helps with that insulin sensitivity, we believe. And again, the dosing is kind of all over the map, but I would stay no more than 300 for sure, and we'll talk about that in a sec. So this first section that I went over, there are some conflicting results on if chromium is really helpful, but overall it does appear to be beneficial. Now the question for you becomes, does it make sense to actually supplement with it? And let's talk about that. So I do think in some cases there's grounds for adding in a chromium supplement. However, I need you to keep a couple of things in mind. I would only do it intermittently. I wouldn't do it long term, I wouldn't do it consistent. Now, I want to back up a step. If you feel that you have to dose or supplement with chromium, that immediately tells you that something is not right in the foods that you're putting in your body. I'm not against supplements in large. I am against using supplements to replace what you should be getting in a well-rounded eating style. I hate the word diet, so I don't use that word, but you have to be eating the right way. If you feel that you have to supplement with something to control your blood sugars, that's telling you something right there. However, if you are going to supplement with chromium, and I do think in certain cases it's worthwhile, I do think it could help control the blood sugars, I would only do it intermittently. I would keep your dose on the low end, 50, maybe 200 mics at the max end, and see how you do. I'm not sold totally on most of the supplements you're going to find are chromium picolinate. I'm not totally sold on picolinate. I think if that's what you have, it's fine. In some of the reports I get from people, you're probably wondering, well, why can't I do it long term? Why do I have to do it intermittently? I get reports from people that they can experience almost like a dopamine rush where they feel good. And then after they've been on it a while, they'll find that they have cold hands and feet, which is usually that the chromium is helping clear the blood sugars so fast that they're almost crashing a bit and getting some of those cold extremities, and it's almost clearing the glucose from the system too well. So I would do it intermittently. This is a big part of the reason why I'm not against chromium picolinate as a supplement form, but maybe experiment with it. Another good example, brewer's yeast is a very good source of chromium. And the other thing, let's get back to the foods. What foods would contain chromium? All sorts of beef, cheese, liver. Never used to be a big liver guy. I'm a huge fan of it now. It's loaded with good stuff. And hey, you can drink wine to get some chromium, so we have that going for us. So at the end of the day, do I think chromium can help with your blood sugars? Yes. I would just follow the guidelines at the end of this video and see how you do. Speaking of which, let me know in the comments, have you tried chromium? Was it helpful, not helpful? Let me know. I appreciate it. And the other people that watch the video, you know, can glean something from your experience. So let us know. I hope this video was helpful, guys. I will see you in the next one. Thank you.